Hello, my name is Natalie Francipane, and this is my teaching presentation on what you need to know about diabetic foot exams. Diabetes 101. Diabetes is a long-lasting or chronic disease where your body either doesn't make enough insulin or it can't use it as well as it should. Insulin is made by the pancreas, which is this organ right here, when you eat any foods that are made up of sugar. After the snack, your blood sugar goes up, and this tells the pancreas to release insulin. Insulin acts like a key to let blood sugar into your body's cells for your body to use as energy. So you're not alone. 34.2 million adults in the United States have diabetes, and 1 in 5 of them do not even know that they have it. It's the 7th leading cause of death in the United States, and the #1 cause of kidney failure, lower limb amputations, and adult blindness. In the last 20 years, the number of adults diagnosed with diabetes has more than doubled. So why is this important? When there isn't enough insulin or cells stop responding to the insulin, too much sugar will stay in your bloodstream, which can cause serious long-term health problems like heart disease, vision loss, kidney disease, and foot ulcers that can lead to amputations, which can affect the brain, the eyes, the heart, the kidneys, the penis, the vagina, the skin, the legs, and the feet. Here's a picture of some symptoms that you may feel if you have diabetes. Always tired, frequently going to the bathroom, always hungry, sexual problems, sudden weight loss, wounds that won't heal, vaginal infections, numbness or tingling to the hands or feet, which is neuropathy, always thirsty, and blurry vision. Neuropathy, which we just talked about, is a form of nerve damage caused by having too much sugar in your bloodstream. Peripheral neuropathy, which is usually in the hands or the feet, can cause tingling, pain, numbness, and weakness. You may feel like your feet tingle, pins and needles, pain or increased sensitivity, burning, stabbing, or shooting pains. Sensitive to the touch. For example, sometimes it may hurt to have the bed covers touch your feet. It may feel like you have socks or gloves on when you don't. Your feet may hurt at night, or your feet and hands may feel very cold or very hot. So ideally, your doctor should perform foot exams at every primary care visit. It's a good idea to schedule a yearly visit with a podiatrist or foot doctor for foot care, education, and management of any trouble spots on your feet. You should also do daily foot exams at home. To do this, you'll need a well-lit room, a hand mirror, and eyeglasses or magnifying glass if you need it. So to test for neuropathy, I made a foot for us to use. There's 4 things that we usually do. We inspect, which is look at the foot. We palpate, we feel the foot and the legs. We can use a monofilament to test for sensation, which I've made a little one right here. And in the clinic, we can use a tuning fork for vibration sense. So when we inspect for our foot exam, you want to look at your legs to see if there's any hair loss on the lower legs, any color changes from the usual. You want to turn your foot over or use a hand mirror to see the bottom of your feet to see if there's any broken skin in between the toes. So you want to peel the toes apart, look in between the toes. Check for any redness, dryness, calluses, irritated or dark areas on the feet. You also want to check the nails. You can check the circulation by pushing the nail in for just a second and letting go, and see if the color returns to normal quickly, which is usually 2 to 5 seconds. Look for any yellowing, thickening, painful areas on or around the nail that are new, and see if the nails look too long or if they dig into your shoes when you wear your shoes. The next thing you want to do is to palpate. When you're checking for temperature, it's always best to use the back of your hand to check for temperatures. You would do like this. So you want to check the legs to see if the legs are warm or cold. Check the feet to see if they're warm or cold. Check for any painful areas of the feet when you touch them, and any areas to the foot that feel sensitive to touch. Also check around your nails to see if there's any painful areas around the nail when you touch them. Next is the monofilament testing. This is our monofilament. It's a small piece of fishing line attached to a paper holder to hold, and it helps you press into different areas of the feet to test for sensation. You can use this little picture right here, which I've added to our foot, and you want to focus on the green areas first. It's best to have a partner, or me, hold the tool and press into the foot while you keep your eyes closed and waiting to feel the touch. So you would want to close your eyes. You'll use a picture as a guide and the monofilament to press into the green areas, followed by the red areas to see what you feel. Notice if the sensation is felt or not felt. And if the sensation is felt in all the areas, to continue to perform your foot exams at home whenever possible. So if the sensation is not felt in some or all of the areas, you need to take notice. These are areas that you cannot feel if anything were to happen to your feet. If you step on a splinter, get an ingrown toenail, or injure the skin in these areas, you will not feel it, which increases the risk for infection, ulcers, and many other potential problems. If you find any other problems, you need to contact your podiatrist, your foot doctor, or your primary care doctor as soon as possible, because getting help early can help small problems becoming large problems. So, prevention is key. Key things: yearly podiatrist exams. Don't walk barefoot. You may step on something and not even know. You always want to wear shoes. It's good to test the water with your hands before bathing to prevent any burns. Wash your feet every day. You can even check your feet in the shower. Do your daily foot exams. Wear shoes that fit well. Trim your toenails carefully and keep your feet clean and dry. This is a picture of the handout that I'll give you to take home from the CDC website with information on how to keep your feet healthy. And here's my references. That's all.